Hey, welcome back, everyone. Welcome to our springtime series here on Healthier You on Facebook Live. We're happy that you're joining us today. We have a great panel of experts here to talk to you about seasonal allergies, springtime ailments. Spring has sprung, a little bit foggy here today in upstate New York, but we're looking forward to a nice spring. And we see some ailments in spring that we don't always see in fall and winter. So we wanted to get our expert panel together and answer some of your questions. We have some questions prepared, but we're happy to take your questions as well. You can get a question in the chat and we'll be happy to answer it. I'm going to introduce myself and my panel. I'm Katie Peglaroli. I'm the Corporate Director for Integrated Healthcare here at Oswego Health, and I'm excited to share with you today Dr. Melanie Groch, one of our ENTs, Dr. Nicholas Groch, one of our ENTs, and Dr. Vandana Patil. She's one of our primary care doctors, and her office is now in Fulton, New York. We're very excited about that practice and opening there. Thank you all for taking time to join me today. We'll go through some questions and have a good little session here. So Dr. Patil, I'm going to start with you. We all suffer through ailments throughout the year. How important, when we have an ailment that we're not sure what's going on, is it to be seen by your primary care physician?
So hello everyone first. So it is very important to have a primary care physician, not because I'm a primary care physician. It is because one, your primary care can help you to catch up on your all age appropriate screening for the cancers and chronic diseases, as well as your primary care can help you to manage your chronic diseases with your specialist and they can coordinate very well. And most important thing also is seeing a primary care is much cost effective compared to going to the emergency room for conditions that we can be taken care of, can be taken care in the office settings. So I will encourage highly that if you don't have one, get one primary care physician.
Great. Thank you so much. Dr. Nick Groch, this question is for you. So everything is blooming or starting to bloom as we're seeing out there. What are some good practices for allergy relief?
That's an excellent question. Hello to everybody out there, and thank you for participating. There are several things you can do to help decrease your symptoms, your allergy type symptoms. First, it's important to know what those symptoms are. Many of you know the symptoms of allergy, some of you may not. Stuffy nose, runny nose, sneezing, headache, facial pain, postnasal drip, all these symptoms can be symptoms of seasonal allergic rhinitis. And a couple of things you can do. First and foremost, and one of my favorites is avoidance. You can avoid the things you react to. Well, sometimes you know that. You go outside to do some lawn work after just mowing and you get stuffy and sneezy and runny. Sometimes you don't know that. One of the ways to know what you're allergic to is by direct observation, as I mentioned, but also by allergy testing. And you're welcome to see your friendly neighborhood Lakeshore ENT office for testing if you or your primary care doctor thinks that it is that it's necessary. Certainly, you're welcome to have us take a look or talk to Dr. Patil and her colleagues. They do a lot of allergies as well. A second thing that you can do is saline nasal spray. Saline nasal spray is not a medication. It is does not require a prescription from a physician. You can get it at the dollar store or Walmart or any of the pharmacies. A couple of sprays a couple of times a day in your nose can help to wash the nose free of those allergens that are causing your symptoms.
Great. Thank you so much. Dr. Melanie Groch, to you. As the weather gets a little bit warmer, we're going to be spending more time in the water, hopefully, and doing some water activities. What are ways to protect our ears from ear infections or ear aches?
Great question. I just want to say, everyone, thank you for joining us today. So yeah, as we approach summer, we're going to see more swimming activities, more summer heat and humidity in general. That can lead to a proliferation of bacteria or even fungus in our ear canal. If that starts growing, that can lead to an ear infection where you can either have the ear canal skin get inflamed, leading to pain, drainage, sometimes even itching of your ears, and even hearing loss. So to prevent that, we try to keep the water out of the ears best you can. So certainly you can do earplugs or a bathing or swim cap. Drying your ears afterwards can help as well. There are also some over-the-counter products that are some ear drying drops that you can place as long as you don't have a hole in your eardrum. That's safe to use. And also just avoiding Q-tips, because Q-tips will trap earwax in the ear canal. That can then lead to excess moisture gathering there and kind of exacerbate the issue.
Great. That's a good tip. I didn't know. Avoid Q-tips. Thank you. All right, Dr. Patil, back to you. Along with being in the water, we're going to be outside enjoying this nice springtime, summer weather that's coming our way. What are some things that we can do to prevent tick bites and Lyme disease? And also, if you are bitten by a tick, what should you do?
So very important thing is make sure you have appropriate clothing. That means wear the long sleeve t-shirt, and the long pants, and make sure you're walking on a marked trail and try to walk in the center of the trail. Try to avoid the like tall grass area where you can see heavy tick infestation as well. Try to use the EPA certified bug repellent, like DEET is very good one as well. There are some not chemical one, natural one we can call, it's called lemon eucalyptus oil. But unfortunately, we are not sure it is really as good as DEET one or not. And some areas where you already know that if there is a heavy tick infestation is there and you're going to be out for a longer hours, then you could use 5% permethrin, and you can put it on your clothes, make sure you dry that clothes and then wear them. And that works really well as well. Now, once you're done going outside, when you indoor again, now if you have a pets, then check your pets, check your children, and try to take a shower within 2 hours as soon as you come inside, and make sure you check all your body folds, because sometimes you do find when you were out walking, there was a tick and you did not even feel the tick bite. So now if you found the tick, make sure you remove it as soon as possible. Unfortunately, Lyme disease, nobody would like to have it, and it has unfortunately a lot of complications. So somebody did have a tick bite, and if you did not notice for a few hours, as soon as you remove, do contact your doctor, especially your primary care physician, because we can do Lyme prophylaxis. It's a very simple thing. There is a medication called doxycycline. Just needs to be a 100 milligram 2 capsule. You just have to take it one time only. And also that prophylaxis also depends, honestly, it depends on your area where you live in. If it's an area that has a 20% of your tick that they identify that, which is a health department does the testings, that has a disease that they carry, Lyme disease, then it recommended for a prophylaxis for everybody. Whereas some areas, they don't have a heavy tick infestation and they don't have those ticks don't carry the Lyme bacteria, those people don't need Lyme disease prophylaxis. So it depends from year to year and it depends on the area. Compared to other states, New York State, unfortunately, is in that area, and we live in Oswego County, which we see heavy tick infestation. So if you have any tick bite this summer as you're walking, make sure you talk to your primary care physician and have your Lyme prophylaxis and learn to identify the symptoms of Lyme disease. If you didn't have a chance to talk or to see a primary care physician, and now you have the symptoms of some rash or joint pain, fever, fatigue, some tingling, numbness, make sure you talk to your primary care physician so we can have a Lyme testing done then.
Great. Thank you so much. That's perfect advice. All right. We had a question from our audience here. As we have been living through this year of COVID, their question is, what are some differences between COVID symptoms and general allergy symptoms?
So COVID symptoms, as everybody knows, that yes, it can start with the nasal congestion, sore throat, fever, body aches, and then depending on more severity of infection, there is a shortness of breath, a lot of people feels, and some diarrhea. We have had patients having that as well, and many more symptoms. So the difference I like to start with, you really cannot differentiate upper respiratory infection from the COVID infection. So as a primary care physician, what we recommend, if you think you have an upper respiratory infection, let's have you tested for a COVID infection as well, just to make sure that this is not a COVID infection. But I'm sure there are minor differences between the allergy and the COVID infection, which I think my ENT colleague will help us to learn about that today.
So certainly that's true. That's an excellent summary, Dr. Patil. In ENT, as regarding the nose, runny nose, nasal congestion, cold type symptoms. And I absolutely agree with Dr. Patil that it can be very difficult to determine whether or not you're dealing with your garden variety cold or viral infection versus COVID. One of the symptoms that does stand out is the loss of a sense of smell. That is common well, I shouldn't say common, but does occur in the setting of COVID infection. So certainly if you've lost your sense of smell, you would need to get in touch with us or your primary care physician right away, and a COVID test would be prudent. It doesn't mean that you have COVID just because you've lost it, but our concern is heightened. Other than that, it's the symptoms of COVID in the endonasal airway or in the nose and sinuses are very similar to a cold or a sinus infection.
Absolutely. And I would just like to add that if you do have other symptoms besides, runny nose and nasal congestion, such as sneezing, itchy eyes, itchy nose, itchy throat, those tend to be allergy related. We don't tend to see those in coronavirus, fortunately. But if you have a fever, cough, if those muscle aches, the GI distress, that more points towards it being coronavirus. But if there's ever any doubt, definitely see your doctor and get tested.
Great advice. Thank you. And I think that's going to be an ongoing question as we come into the springtime. So those were really beneficial answers for us, and we appreciate that. The next one is, can allergies onset at any age?
Dr. Melanie?
Oh, sure, I can answer. Yeah, absolutely. So allergies can occur from the day we're born all the way until the end of our life. We tend to see them start developing, in the toddler stage, and certainly in younger ages, teen. But we can even start seeing them develop into adulthood.
Great. I agree. We see patients just about every day from all over the spectrum regarding these symptoms. And the testing that we perform in the office is relatively pain-free. It really is. A lot of people think that allergy testing is painful and involves needles, and it does not. We start about the age of 5 or 6. It depends on the child, but it's a frequent question. Why now, doc? I'm 50. Why now? I'm 60. I'm 70. I'm 35. And we really don't know why that is. It hasn't been clearly delineated yet on what the pathophysiology is behind it that leads to a certain symptomatology at a certain age, but it can be anytime.
Great.
Yeah, our immune system is constantly changing. That's a great thing. If you get a vaccine or you have the flu one year, it offers some protection down the road. But with our immune system constantly looking for issues to defend yourself, you can sometimes develop allergies, which is an overreaction of your immune system, where it thinks that allergen is going to hurt you. It releases all these chemicals to help protect you. But unfortunately, those affect your nose and sinuses and throat, and we get allergy symptoms. But we can basically capitalize on that. And if you do have allergies, give you allergy shots and retrain your immune system not to overreact in the first place.
That's excellent. That's a great way to describe how our bodies are designed to work and protect us, and can also lead to allergies. All right. Well, I think those are our questions for today. This has been so informative. I want to thank our panel of experts for taking the time to join us today. I'd love to hear about all of the recommendations that you have and answered all of our questions. And we hope that we've answered your questions out there. And we will be holding our next Healthier You event in May related to mental health. So we hope that you'll join us again. And thank you, everyone, and have a great day, and get your care here right at home.
Thank you.
Thanks.